So, good day, ma'am. My name is J. Budhouse Berlio from Biz in One. So now is I'm going to assessing the head to toe assessment. But first is I'm going to wash my hand to avoid microorganism. So after washing my hands, so I'm going to put some sanitizer or alcohol to make our hands to secure and clean. So after I wash my hand, then put some alcohol, um, I'm going to introduce myself to the patient. So, sir, good day. My name is Nesje Vedas Murillo. I am your nurse for today. I am going to assessing your hair, skin, and nails. If it is okay to you, sir.
Yes, sir.
So after the patient is agreed, so let's proceed. Is inspect general skin coloration. Keep in mind that the amount of pigment in the skin amount for the intensity of the color as well as hue. So inspect for color variation. Inspect localized part of the body, noting any color variation. So the possible abnormal findings for skin coloration is bluish cyanotic, then jaundice, and also the acanthosis nigricans. So, inspect skin for variation in coloration and integrity. So next is inspect for lesion. Observe the skin surface to detect abnormalities. If you observe a lesion, note symmetry, borders, and shape, color, diameter of lesion, and change in lesion over time. For every small lesion, use a magnifying glass to note this characteristic. Note its location, distribution, and configuration. Measure the lesion with a centimeter ruler. Then, palpate a lesion. So next is to palpate to assess moisture. Check under skin fold and its and exposed areas. So assessing temperature and moisture by using at the back of your hand. So next is to palpate to assess mobility and trigger. Ask the client to lay down using two fingers. Uh, Gently pinch the skin over the clavicle. So sir, can you lay down?
Okay.
So pinch the clavicle. So next is to palpate to detect edema. So use your thumbs to press down on the skin of the feet and ankles. So both ankle. Then next is to the feet. So next is to inspect the scalp and hair for general color and condition. Then, so the patient is there's no any folliculitis or the patchy hair loss. And also the hair color of the patient is um, color black, and there's no any white hair. So next it's inspect nails, grooming, and cleanliness. so the nails of the patient are clean. So the next is inspecting nails color and marking. So pink tone should be seen. Some longitudinal ranging is normal. Then also inspect the shape of the nails. So there is a normally as 160-degree angle between the nail's base and the skin. So test capillary refill in nail bed by pressing the nail tip briefly and watching for color change. So pink tone return is immediately to blanch nail bed when pressure is released. So next is inspect the head, inspect for size, shape, and configuration. Then next, inspect the face, inspect for symmetry, feature, movement, expression, and skin condition. So the face is symmetric with a round, oval, elongated, or square appearance. No abnormal movement noted. So next is palpate the temporal artery, which is located between the top of the ear and the eye. Then palpate the temporomandibular. So next is to palpate the temporomandibular joint. Then ask the patient to open his mouth. So sorry, can you open your mouth? Then close. Then open again. Then close. So the normally there is no swelling, tenderness, or crepitation with movement. Mouth opens and closes. So next is inspect the neck. So observe the client slightly extended or his neck. So sir, can you extend your neck? So next is to inspect movement of the neck structure. So ask the client to swallow a small sip of water. Observe the movement of the thyroid cartilage, thyroid gland. So sir, can you drink small cup of water? Then the thyroid cartilage and cricoid is cartilage move upward symmetrically as a client swallow. So next is to inspect range of motion. So ask the client to turn the head to the right. So then and to the left. Then touch each ear to the shoulder. Then touch chin to chest. Then and lift the chin to the ceiling. So next, to palpate the trachea, place your finger in the in, internal notch, which is the side of the notch, and palpate the tracheal rings. So next is ask the client to swallow as you palpate the right side of the gland. Reverse the technique to palpate the left lobe of the thyroid. So, sir, can you swallow some water? So next is to auscultate the thyroid only if you find enlarged thyroid gland during inspection or palpation. So place the bell of the stethoscope over the lateral lobes of the thyroid gland. So ask the client to hold his or her breath to to obscure any tracheal breath sounds while you auscultate. So, sir, can you hold your breath? So, no broths are auscultated. So, next is to palpate the tonsillar nodes at the angle of the mandible on the anterior edge of the sternomastoid muscle. Then next is to palpating the submandibular nodes, which are a few centimeter behind the tip of the mandible. So next is to palpate the supraclavicular node by hooking your finger over the clavicles and feeling deeply between the clavicles and the sternomastoid muscle. So next is I'm going to assessing the eyes. So test distant visual acuity. So position the client 20 feet from the Snellen or eye chart. So, sir, I'm going to um, show to you what is the number. So, can you tell? 14. 14. So next is I'm going to performing the confrontation test to assess visual fields. So, sir, um, um, hawakan mo tong papel, tapos i-cover mo sa right eye mo. Then, I'm going to test to you. So, sir, ilan to?
1,
Ito.
2,
So, next is performing cover test. So, cover the test detect deviation in alignment or strength and slight deviations in eye movement by interrupting the fusion reflex and normally keeps the eye parallel. So, ask the client to stare straight ahead at the focus on distant object like, so sir, can you focus that electric fan?
okay,
Then cover one of the client eyes. Then with an opaque card. Then you cover the eye, observe the uncovered eye for movement. Now remove the opaque card and observe the previously covered eye for the any movement. Then repeat to the opposite eye. So the other eye. So the next is I'm going to performing the positions test. So sir, can you follow this pin light?
okay,
So next, let's inspect the bulbar conjunctiva and sclera. Have the client keep the head straight while looking from the side to side, then up toward the client. Then observe clarity, color, and texture. So, sir, can you look down? So next is I'm going to put on gloves. For this assessment procedure, first inspect the palpebral conjunctiva of the lower eyelid by placing your thumbs bilaterally at the level of the lower bony orbital rim and gently pulling down to expose the palpebral conjunctiva. So avoid putting pressure in the eye. Then ask the client to look up to observe the exposed area. So sir, can you um, look up? Then, so the lower and upper palpebral conjunctivas are clear and free of swelling or lesion. So, over the upper eyelid, ask the client to look down with his or her eyes slightly open. So, sir, can you um, down your eyes? Then, place a cotton. So, place a cotton tip to applicator approximate 1 cm above the eyelid margin and push down with a applicator while still holding the eyelash. Then hold the eyelash against the upper right of the bony orbit just below the eyebrow to maintain the everted position of the eyelid. Examine the palpation of the conjunctiva for swelling, foreign bodies, or trauma. So next is palpating the lacrimal apparatus. So put on the disposable gloves to palpate the nasolacrimal duct to assess the blockage. Use the finger and palpate this inside the lower optical rim. So next is test accommodation of pupils. Accommodation occurs when the client moves his or her focus on vision from the distant point of near object, causing the pupil to constrict. Hold your finger or a pencil about or a pin light or to 12 to 15 in front of the client. Then ask the client to focus on your finger or pencil or pin light and to remain focused on it as you move in closer toward the eyelids. So sir, can you focus this pin light?
Okay.
So using ophthalmoscope or pin light, so inspect the internal eye to observe the red reflex set of diopter on the 0 and stand 10 to 15 in from the client's right side at a 15-degree angle. So inspecting the red reflect. So next is I'm going to assessing the ears. So inspect the auricle tragus and lobule. So note size, shape, and position of the ears. So the ears are equal in size bilaterally. So the auricle aligns with corner of each eye and within a 10-degree angle of the vertical position. So the next is I'm going to continue inspecting the auricle tragus and lobules. Observe for a lesion, discoloration, and discharge. So palpate the auricle and the mustard process. So, So the skin is smooth with no lesion, lumps, or the nodules. So color is consistent with the facial color. So the normally of the auricle tragus and mostoid process are not tender. So the next is I'm going to assessing the mouth, throat, nose, and sinuses. So but first is I'm going to inspect the lips, observe lips consistency and color. So lips are smooth and moist without lesions or swelling. So next is I'm going to inspect the teeth and gums. So sir, can you open your mouth? So sir, close. Then next is ask the client to bite down as thought chewing on something and note the alignment of the lower and upper jaw. So sir, can you bite down here, no? No, no decayed areas, no missing teeth. So, so next, it's inspect the vocal mucosa. So use the pin light and tongue depressor to retract the lips and cheeks to cheek color and consistency. So, sir, can you open your mouth? So, the vocal mucosa should be upper pink and light skin client. So next is inspect the palpate the tongue. So, sir, can you up your tongue? So the tongue should be pink, moist, and moderate size with a pili. So next is inspecting the dorsal surface of the tongue. So sir, can you up your tongue? So the client can distinguish between sweet and salty. So the client is distinguish the sweetness. So next is inspect the tonsil. Use the tongue depressor to keep the mouth open wide. Inspect the tonsil for color, size, and presence of exudate or lesion. Grade the tonsil. So sir, can you open your mouth? And um, and also your tongue. Okay. So tonsil may be a presence of or absent. They are normally pink and symmetric and may be enlarged to 1 plus in healthy client. So next is inspect the posterior pharyngeal wall, keeping the tongue depressor in place. Shine the pin light on the back of the throat. Observe the color of the throat and note the exudate or lesion before inspecting the nose, discharge gloves, and perform the. Okay. So sorry, can you open your mouth? So after they inspecting the nose and discharge glove and perform hand hygiene, so I'm going to remove my gloves. and prepare hand hygiene. So next is I'm going to palpate the sinuses. So when the infection is suspected, and the nurse is examine the sinuses through the palpation. So palpate the frontal sinuses. So sir, can you feel any pain?
No.
Then the next is I'm going to palpating the maxillary sinuses. Can you feel any pain, sir?
No.
Is I'm going to assessing the abdomen. So first is I'm going to perform the light palpation. Then next is performing the deep, the manual palpation. Sir, any pain that you feel?
No.
Here.
No.
The next is normally palpable structure in the abdomen. Any pain that you feel, sir?
No.
Okay. Then next is performing the blunt percussion over the kidney. Okay, so everything is normal. So the last is I'm going to assessing the feet. But first is I'm going to pinch every nails of the feet of the patient. Then next is I'm going to push the feet of the patient. Okay, so everything is normal. So, sir, can you up your feet? Okay, down. So, everything is normal. So, then I'm going to remove the gloves and applying hand hygiene.